Good afternoon,
Hey,
Elevate
guys.
fam.
Hey, thanks for tuning in. So today, me and Zach Cupples, we're going to be talking a little bit about what is this neck pain. We want to bring you guys a little bit of information and kind of get you guys in tune with how we think about the neck and some things to consider, maybe some ergonomics, some things that can help. So first off, we're just going to get right into it. We're going to start about in the current situation that we're in right now, we definitely have a lot more changes in our day-to-days. A lot of people, I should say. Workspace changes, all that stuff. When we look at that, especially from like a clinical standpoint, we always look at, in history, we always think, if there's an injury that presents, let's see what happened prior to this injury to see if there's any changes in load to those tissues. So when Zach and I are taking a patient history, we're looking at, what did their week prior, their 2 weeks prior look like to those tissues that are actually in pain or causing some of those pains, and we try to decipher, was there a significant increase in changes to those loads? So like being in a certain posture, if we're in a certain posture where we're now all of a sudden kind of hunched over, round over for 8 to 9 hours a day, yeah, that's going to definitely change postures quite a bit. So looking at drastic changes in your own posture, give yourself that self-assessment of look at those last 2 weeks and see, did you change anything pretty significantly? If you did, that's definitely something that's going to give you a little bit more exposure or risk to having things be painful.
You want to think of it this way. With us living in Vegas, we oftentimes have people come visit us because they want to go to the Strip or go to downtown Vegas or anything like that. And if you are one of the Vegas locals like ourselves, you might not be going out on a regular basis. And so if you go out with your friends and you party a little too hard, what happens when you wake up the next morning?
Brutal.
It's brutal. It's bad news. And that's because you've likely consumed too much alcohol compared to your baseline. That's very similar to the process that we go when we're changing positions or we're sitting for prolonged periods of time or we're doing any type of activity that we haven't normally been accustomed to. I'm not condoning drinking on a regular basis, but the person who drinks consistently leading up to that time on the Vegas Strip is going to fare better than the person who is a teetotaler or does not drink much and then goes and parties with the friends who come and visit.
So we got to condition ourselves with drinking.
Yes. I would either do that, or if you have to sit for long periods of time because now you're working at home or you're stuck in the house and you don't have anything to do, you have to realize that there's an accommodation period that your body has to undergo in order to tolerate those positions. So if you have to work from home, make sure you get up frequently so you're not exposed to those long periods of load, and that should lead you to tolerating those tasks a bit better.
Yeah, definitely breaking some of that stuff up. When we look at maybe sedentary, like not moving, just like what Zach was saying, not moving and getting up and moving, what is that really truly doing during that time? When we get up and we move, we're getting circulation. We're getting things to start moving in our blood to start moving around. That's so key in these chronic aches and pains in certain people's tissues because they're in a certain position for a really long time and they're not getting any significant blood flow to those areas. It's what's called ischemic pain. So when we have ischemic pain, ischemic means without blood, and we don't get like the right nutrients to those areas. So that can cause pain over time. Imagine flexing your bicep for 20 minutes. That doesn't feel good because when you're flexed for that long, there's not a lot of blood flow going in. It looks all veiny and stuff because it's kind of trapping some of those areas of blood and keeping it in one spot. It's the constant contract, relax. That's what actually creates some of those movements of fluids in your body. So making sure that blood flow is staying high is also something we need to definitely look at when we changed our activities pretty drastically.
How did you know my morning routine? I start every morning with
Bicep
a 20-minute bicep flex.
Yeah, I just use that with patients a lot because it makes sense to them if they were to actually flex their bicep for 20 minutes, right? You know, they would cramp, it would hurt really bad, right? So it makes people connect with that a lot.
Absolutely. Well, and it's another analogy that I like to use too is a long car ride. Anytime someone's in a car for an extended period of time, they're not moving, they're sitting for prolonged periods of time. You know, you're going to LA and you got that 4-hour drive and and you're not moving. And what happens? Well, you start to get sore, stiff. If you're like me, when I drove here from Illinois, you lose your toe touch. And like all of these things happen as secondary to you not getting the normal distribution of blood flow that you would otherwise. And the fix is you get up, you take a break, you go and walk a little bit. Maybe you stop at a rest area so you have that redistribution of blood flow. We have to take that same approach to not moving as much when you are locked up in your home. So taking frequent breaks to get up, move, walk around, stretch, do some activities that perhaps one of us have prescribed to you, all of that can be useful at redistributing that blood flow. And if you don't do that, then you are going to be more predisposed to hurting anywhere, especially if you're on your screen a lot more because what the heck else is there to do? That could be one issue why you might be getting more neck tension than you normally would have.
Yeah, your body definitely gives you these signs, though. It gives you these, like get up and move signs. Don't not listen to them. Make sure that you're checking in with your body, and if your body is saying, okay, I'm getting stiff, I'm getting kind of, stiff and sore, don't try to bang out another hour before you get up and move. Make sure that you're taking those breaks that Zach was kind of talking about. So looking at another kind of factor of increased activities is also going to be something, it's not necessarily an activity, it's going to be how we handle stress. So when we handle stress, we make sure that we're trying to figure out how we can disconnect from that stress, because stress is natural in the human body. We're going to have stresses, but we need to figure out how to manage that stuff and how to disconnect from it. So when we look at not being able to disconnect from stresses, it can cause tensions. It can cause things in our body that we don't really like. So make sure that there's ways that you know you're going to have your go-tos of getting rid of that stress. If it's going for a walk, if it's going to talk to someone that you kind of brings you back down. I'll just talk to Zach. He usually makes me laugh pretty much every time. But if there's someone in your life, if there's something that you can do to make yourself disconnect from that stressful situation, that's a big avenue for decreasing the amount of tension that you have in your body.
There's a lot of good research out there showing that stress can enhance pain. It leads to physical changes within your nervous system. So your nervous system starts to respond and get activated by many of the stress hormones that we produce when we're stressed throughout the day. So I would echo that. It's important to take the time to disconnect, spend time meditating, or as we mentioned previously, getting up and moving.
Yeah.
Movement helps nourish your nervous system. It floods your body with good hormones that help reduce pain and stiffness, and it's an important aspect of mitigating the stress that we might have a little bit more of nowadays, considering all that's going on.
Yeah, in addition, like when he quoted some research, and he's a research wizard, but I don't know if this is an actual research topic, but they were when I was reading this, they were saying that the body has this capability of only answering or having so many decisions that it can make in a certain day. So if you are constantly bombarding yourself with decisions and burning yourself out with those stressful kind of questions over and over, you're always questioning yourself or questioning the situation, that's a quick way to run out of decisions. And then once you run out of decisions, your body starts influencing how much pain it can actually have. It'll tolerate less and increase pain receptors in your body. So again, kind of going back and forth between what the body does with stress is it's really important for mitigating the amount of pain that you have. Let's see what's up next. So workspace changes.
So as this piggybacks a lot of what we talked about before, we're in a different environment, our habits are changing, and our work environment that we are normally accustomed to might also be different. The desk at work might not be the same desk that you have at home, and so you might not be used to being in those positions. So you want to, whatever your work environment was before, if you felt good and you tolerated that, you want to try as best as possible to replicate the same thing at home. I don't think that there's necessarily any one specific sitting posture that is better than another. It's not the best to be perched up, or it's the best to be slouched for an extended period of time. It goes back to the tissue ischemia that we mentioned before. If you stay in any one position for a prolonged period of time, that could be problematic. With your workspace, the best workspace posture and positioning that you can have is one that's changing frequently. A good thing that I recommend to a lot of people is the adjustable sitting stand-up desk. So you can, that way you're not sticking into one position for any prolonged period of time, and then if you throw frequent movement throughout the day on top of that, you ought to be able to sustain working in more sedentary positions and postures for long periods of time.
Yeah, that's the true definition of creating an efficient workspace, is something that you can get up and move out of and flow in and out of pretty seamlessly. If you can do that stuff pretty quickly, then you don't have to lose a lot of work time too. So setting your space up for that is key for getting a lot of movement in and making sure that stuff can change. One thing that I definitely want to hit on really quick about ergonomics is making sure that beds and couches and things that are going to kind of just suck us into and make us glued to it, those are not really efficient for creating a sustainable workspace for you. Not only is it just going to kind of glue you to the chair most of the time, or get you kind of sucked into those areas and glue you to them, all those things are usually used for other purposes too. You know, you're going to be having people come in and out of to watch TV on the couch, or if someone's eating and they want to, sit on the couch. Those areas should be workspace areas that you guys set those things in, set those up on. So make sure that the bed and the couch are not part of your workspace areas. I think that's really important for, again, sustainability and ergonomics.
If you think about it too, from associating certain things, if you're working in your bed and your bed is meant for rest, relaxation, and sleep, your brain unconsciously will associate the stressors of work with the bed, and that could negatively influence and impact your sleep. So it's important to create that dichotomy of workspace and leisure space and rest and recover space. Two, if you are working in bed, chances are you're probably doing it before you go to bed. And if that's the case, then you're getting all of this light into your eyes that has been shown to influence the hormones that are more produced when you are awake as opposed to when you are sleeping. So we're talking melatonin versus cortisol. Another reason why working on beds, couches, or places where you should be chilling like Bob Dylan is not a good idea.
Chilling like Bob Dylan. What can you do to help yourself? That's kind of what we're going to get into next. We're going to look at a couple of different sections. And first one up, or it's more of a concept, is we're talking about neck pain. So things around the neck. What are things around the neck? We got the face, we got the thoracic spine, we got the shoulders. Those are things that are around the neck. We want to see if we can influence as much as we can the blood and the circulation in those areas as we can. So if we're moving those areas and the tissues that are painful or irritated, those aren't having to move as much, then we can influence the healing of that. So we want to look around there. So we're looking at the thoracic spine. That's what we're going to kind of really work on when we start showing a couple of moves that's what I will be looking at. Zach's going to look at a couple other things, and he's going to explain why. We're going to look at more of the mouth and the face. But making sure that we look at those other areas that are not painful at this time, because we don't want to sit there and poke at something that's painful, right? Because that'll just kind of pick at the scab. We want to make sure that we're letting our body heal itself And if we're letting our body heal itself, then we move other stuff that's going to be close to the area, but it can still influence the amount of circulation that we have at the area. So thoracic spine is one of the main ones that we really want to hammer for doing that, and it's really close to the cervical spine or the neck area. The thoracic spine, if anybody doesn't know, thoracic spine is between these two fingers. We got between the thumb and between the index finger. Thoracic spine is your upper back.
Within the thoracic spine and also within the neck, those areas on your body are prime real estate for breathing. For those of you who don't know, within your thoracic spine and your rib cage is your lungs. The upper parts of the airway pass through your neck and into your face and your jaw. There are lots of muscles that attach to your neck that also have attachments at the jaw and the face, as well as the rib cage. So if you lack full mobility or full breath excursion in those areas, that's going to change the amount of relative tension that you have in some of the muscles in your neck. And if one of the keys to having a healthy, not stiff, and non-painful neck is constant blood flow distribution, and you have this increased tension in the system because of alterations in your breathing quality or quantity, then you have these neck muscles essentially doing two jobs at once. Now, no one likes to work two jobs at once except, me, but I got my issues. So if you have neck muscles that are helping you breathe and they're also helping you with moving your neck, those tissues get overworked, underpaid, and can have that ischemic response that we talked about previously. So ensuring that you can create adequate rib cage mobility by being able to breathe into all parts of the lung field, as well as establishing good postures and positioning up in the neck and the face, that can lead to profound changes in the amount of tension that you carry up in this neck region.
Yeah, and I think the anterior neck or the front of the neck can definitely play a good support system for the back portions of the neck, because typically when I've seen patients, it's usually back of the neck is where we get the most of the pain, and a lot of times some of the stuff in the front of the neck is a culprit, and we can definitely attack some of the front portion of the neck to support the back of the neck. Let's see. So we have breathing, tension. Do we want to get right into tongue stuff?
I've talked a little bit about it, so
Okay.
we can move on to some
All right.
treatments.
So for viewers that are on right now, let's just, if there's any questions, try to get that in the comments, because we're going to start getting into just a couple of movements for you guys to try. I'll show a couple. Zach's going to show a couple, and then we'll answer some of the questions if there is any at the very end. Does that work?
Let's do it. Let's get nuts.
All right, so first one, and I tried to make this as easy for a desk setting as possible, because I think this is targeting a lot of people that are having desk type pains or seated type pains because of the change in activities. So this is what's called a Cressy Curl, but it's modified for a desk. So say this is my desk area. So I'm on a rolling chair, so that's actually pretty useful with this one. If you don't have a rolling chair, that's totally fine too. But we're gonna see if we can just support our elbows, and then we're gonna push our hips, or start pushing our hips back. Not too far, not to where you're already kind of like all the way out, but just start pushing hips back so your hips are behind your shoulders. As our hips go back, we're gonna start letting our hands come up, and we're gonna act as if there's a string attached right to our sternum. That string is gonna be pulled forward or pulled down towards the ground. So it's going to look like I'm going into a arched upper back. And we're trying to get those muscles to squeeze and then relax. Squeeze and then relax. So this is what it's going to look like. We're going to go here. We're going to sink back. We're going to drop our sternum forward, curl the arms, and let this go into a little bit of extension. And then we're going to come back out. So we go into that full kind of flexed, rounded upper back to a maximum extension of the upper back, and don't try to squeeze more range of motion than you typically have. just try to think you're trying to squeeze the muscles and relax them, squeeze them and relax them, so you're forcing a lot of blood flow into that area. So say this is my office chair. I'm going to scoot myself forward until the top of the desk, the top of the chair is in the mid to upper portions of my back. And I'm going to put my hands behind my head, and then I'm going to slowly get into a little bit of extension and coming back out. So I'm pulling my shoulders actively back and coming back out, again, creating a little bit of motion at the top portion of my spine. So again, if we're rounded forward or in that posture for a long time, it's hard to get out of that. So this is a good one to get us out of that flexed forward posture, just kind of getting a little bit of a hinge through that area. There's another way to do this, and it takes a little bit of a firm surface. Same kind of concept. We're trying to get the top portion of our upper back to move around a little bit. So let's scoot close to the edge, support our head, and let our head drop slowly into a little bit of extension and then coming back up. I already had a couple of little movements in my upper back, but it's a good way to force a little bit of extension through there. So those are the two movements that I think could potentially get you some good movement into the upper back. And if that's really helpful, let us know in the comments.
We're going to talk about utilizing breathing to do two things. The first thing we're going to work on is to piggyback off of many of the wonderful moves that Kyle used. A lot of us, when we're sitting for prolonged periods of time, assume a rounded posture, head going forward. Now, how often do we ask, though, why does someone have that type of posture? Is it because you want to make your mom upset? No. I think there is an actual reason as to why that is. And one reason is because it is an easier way, a more efficient way for your body to get air in and out. When you assume this slouched position and your head comes forward, the airway in your neck actually opens up and your tongue muscle drops down, so it allows you to get air in through your mouth. You can get a larger quantity of air when you are breathing in through your mouth, which is good if you need, if you're being chased by a bear or you're performing on the field at a high level. But it's not good when you're watching Netflix and typing up stuff for your job. So it's not because your mom hasn't yelled at you enough to sit up straight. It is a compensatory breathing strategy that we are using to cope with the situation at hand. It's a stressful breathing pattern. I'm going to show you two great moves to undo that. The first thing is actually going to be to get stretching occurring in your upper back. You're going to actually make it more rounded. What? Zach, you just said that. I'm sitting chilling like this and I'm rounded as can be. The difference is when I sit in this slouched posture, it's not a uniform curve. Most of us actually hinge at one point in the mid-back to create that forward position. The normal spine should have some degree of backward curve to it. So I'm going to show you an activity to create that backward curve. Here's what you're going to do. You're going to sit at your desk, but instead of being slouched, I want you to think about your chest or your sternum, your breastbone, whatever you want to call it. That needs to be parallel to the wall. From here, what you're going to do is you're going to rock your hips back, keeping that chest parallel to the wall, so you get a little bit of a tilt at the pelvis. The next piece, make an X with your hands and your fists, and that's going to go between your knees. You're actually going to push the shoulders forward to open up the upper back uniformly. As you do this reach, you want to make sure that you don't fall back into your forward rounded posture. You're going to reach just like so. Once you're in this position, to get that nice, wonderful stretch in your upper back, you're going to breathe. Here's how I want you to do it. You want to go silently in through the nose. Imagine Michael Myers from the Halloween movies is in your bathroom. You don't want him to hear you. You're going to let out a nice, long exhale. Get as much air out as humanly possible. Kyle, you might want to move. I don't want to, spread viruses to you. You're going to get as much air out as humanly possible. With that exhale, you're going to get a little bit of ab tension. That's normal. You want to maintain that ab tension as you inhale. As I had mentioned before, when you breathe in, if we're using this stressful breathing pattern, your neck muscles start to do the job that a lot of your other muscles should be doing. If you keep ab tension, not by bracing, but from the exhale, that puts the neck muscles at a disadvantage. It pulls the rib cage down so the neck muscles can't pull the rib cage up. And if you get it right, you're going to feel a nice, wonderful stretch in your upper back. That would be move number 1. Move number 2. I had mentioned that if we're in this forward position, it opens up the airway and forces you to mouth breathe. If I want to reduce neck tension, because that's a compensatory breathing strategy, it's one that promotes more neck tension, changing the position of my tongue can prove incredibly useful at doing that. Because if I can place my tongue on the roof of my mouth, which is a normal, ideal tongue posture, it will promote nasal breathing and reduce some of the stress and strain that you might be getting on your neck. It eliminates the next job as breathing muscles. So the first thing you can work on is if you say the letter N, so go ahead and say N, where the tip of your tongue hits, once you finish saying that letter, that's where your tongue needs to be at rest. So if you can think about placing your tongue there, that's one big piece. We also want to encourage the back of the tongue to also be up on the roof of the mouth. For that, I got a simple drill for you wonderful folks. You want to make a clucking noise like you are a chicken. When you do that, your whole tongue goes up on the roof of your mouth. It creates a suction effect on the roof, promoting that resting tongue posture that we so desire. So you want to make clucking noises. As you do that, be careful. Some people will cheat by doing this. You want to make it a loud cluck, like you are whipping your tongue up and down. And if you do those things, get upper back stretch, get your tongue tip on the roof of your mouth, and then cluck. Those ought to be some wonderful strategies, along with the moves that Kyle showed us, to help reduce your neck strain and tension, especially throughout your workday. And if you throw on physical activity along with that, you ought to be in business.
That's obviously a specialty of his. He likes to work a lot with tongue postures and stuff like that. But again, when we look at the face and we look at the upper back, again, it's the muscles contracting and relaxing and trying to get those things to start promoting some more circulation. Again, that's one of the key things that Elevate really tries to focus on is movement truly is medicine, and trying to figure out how your movement is going to influence your pain and your dysfunction. That's what we're here for. We really want to make sure that you understand yourself better, and those things can be handled, and you can identify them. You can learn together with us. If there is any questions at this time, put them into the comments, and we'll hang out for another minute or so. Looks like we got couple of questions.
So the first question comes from Paul Dahl. Do you have a recommended reps sets for the tongue exercise? So for the N and keeping your tongue on the roof of your mouth, I would create reminders throughout the day as frequently as possible for you to get into that position. So I have people set reminders on their phone, say every couple of hours, hey, where's your tongue at? Oh, snap, I've been mouth breathing the last 2 hours. Let me get my tongue back up there. For the clucks, it's not really something that you could overdo, although these muscles do fatigue like any other muscles. I would aim for 50 clucks in a day.
That's cool.
So, good question.
Yeah, and it's probably not something that you're not lifting weights, not resistance type training. It's not going to be something that you'll burn out really quickly. But if you're getting that in, you're kind of setting that time clock in your head. I need to get my stuff done. So
yeah.
It gets you on more routine based stuff.
It's great to do when you do your 20-minute bicep flex in the morning, like I do. Yep.
Yeah. Well, it's It's something that's going to be required of Elevate
Yes.
medical providers now. So
Yeah.
20 minutes. All right, guys. If there's any more questions, we will get back to them in the comments section after this. And we hope you guys are staying safe out there. Again, if there's any questions, shoot us a comment, or if you need to reach out to us, find us on our Instagram handle. Cool.
Sounds good.
See you guys.
Be safe, be healthy.
Have a good one.